Hello guys, welcome back to Medico Days. So today we'll be discussing the Psychiatry PYQs in this video. But before moving on to the details of this video, I'm happy to inform you all that our book is ready and all the 7 years PYQs of Neetpg are available in our book, and along with small explanations, the very important brief points. So it is provided at a very nominal price and it will be helpful for you for the last minute revision. It will be provided as a PDF, and if at all you are interested, you can contact me in Telegram and I'll be sharing you the sample PDF, and if you guys find it useful, then you can buy our PDF. It'll be really helpful to have a gist of all the PYQs in the last days while it is nearing to the exam, and all the same content is available as video. We'll be uploading the other subjects videos as well soon. So today we'll be discussing about psychiatry in this one. So first question from 2018. A 40-year-old woman involved in a car accident 2 months ago reports recurrent nightmares and screaming at night. What is the diagnosis? Answer is post-traumatic stress disorder. So that is also known as PTSD. It is characterized by re-experiencing symptoms like nightmares, flashbacks following a life-threatening event, and it persists for more than 1 month. And the other options like acute stress disorder, it is usually resolving within 1 month. Adjustment disorder involves stressors like financial or relationship issues, and it is not associated with trauma. And mania is a completely different entity. It presents with elevated mood and there is no trauma-related symptoms. Next question, which features strongly suggest delirium? So fluctuating course is an important feature of delirium. Delirium has acute onset, fluctuating symptoms and impaired consciousness. Gradual onset and preserved consciousness are seen in dementia, when visual hallucinations are more commonly seen in delirium. So delirium and dementia differences are important, guys. Please learn them. Next, relieving repressed trauma to achieve emotional release is termed as. So this is a direct question and it is known as abreaction. It involves conscious relieving of repressed trauma for emotional discharge. And catharsis is something related to this. It is a broader term for emotional release and it is usually through art or any other forms. And next one, what term replaced mental retardation in DSM-5? Answer is intellectual disability. Next question, the confusion assessment method is used for, this is a previous year topic, and it is used for delirium. So confusion assessment method detects delirium via bedside assessment of acute onset, fluctuating course and inattention. Next question, which condition was previously called minimal brain dysfunction? It is ADHD. It was historically termed as minimal brain dysfunction. Next, Siemens squeeze technique treats. Answer is premature ejaculation. This again is a previous year topic. So the squeeze technique delays the ejaculation via behavioral interruption. Next one, Addison's disease mimics which psychiatric disorder? Answer is depression, because Addison's disease causes apathy, fatigue and social withdrawal mimicking depression. Next question, which is not an OCD related disorder? Answer is temper tantrum. OCD related disorders include hoarding, hair pulling and skin picking, and the OCD related questions are like coming up nowadays in every other exam like FMG or ANICET. Also OCD related questions are coming up, their management, all these are very important, so please learn about them. Next, which is false about Alzheimer's disease? Alzheimer's, again from pathology point of view, from medicine point of view, psychiatry, everywhere Alzheimer's is again important. So the false statement is nucleus of Maynard is unaffected. That is the wrong one, because the nucleus of Maynard is which is the source of cholinergic neurons, is affected, causing memory deficits in Alzheimer's disease. Neurofibrillary tangles and plaques, that is beta amyloid, are the hallmark findings in Alzheimer's. Now moving on to 2019 PYQs of psychiatry. Which of the following drugs is used as an anti-smoking agent? Answer is varenicline. It is a partial agonist at the alpha-4 beta-2 nicotinic acetylcholine receptors, reducing the nicotinic cravings and withdrawal. FDA approved smoking cessation agents are NRT, bupropion and varenicline. Next, what is false regarding somnambulism? Answer is person will have full consciousness. That's the wrong one. Somnambulism, which is also known as sleepwalking, it occurs without full consciousness and it is a disorder of sleep arousal, often ends in confusion and may link to neurological conditions. Next, which of the following is not a risk factor for delusional disorder? Answer is young age, because advanced age is a risk factor, not young age. The wrong one is young age. It should be advanced age, which is the associated one. Premature ejaculation is a disorder of which phase of normal sexual cycle? This again is a previous year topic. So premature ejaculation is associated with the orgasm phase, and it involves early orgasm before desired affecting the orgasm phase. So the other phases and their disorders, please learn, very important. Next, confusion assessment test is used in this, again directly a PYQ from the previous year. So answer is delirium. Next question, which of the following has poor prognosis with exposure and response prevention in OCD? As I've told, OCD related questions are becoming favorite nowadays. So hoarding is the answer. It has poorer prognosis because of low insight, resistance to treatment and complexity. Next question, what is fear of heights known as? Answer is acrophobia. So others are like acarophobia is fear of mites, algophobia is fear of pain, and agoraphobia is fear of open spaces. Now 2020 PYQs, a 25-year-old male presented to clinic with a complaint of feeling of insects crawling under the skin. Which drug abuse can cause the symptoms of this patient? Answer is cocaine. Formication, which is sensation of insects crawling under the skin, is a hallmark of cocaine abuse, and it is also known as cocaine bugs. So cocaine intoxication can mimic schizophrenia with paranoia and delusions. Amphetamine can cause psychosis, but there won't be formication. Next, a 60-year-old male who lost his wife 3 months back complains that his intestines have become rotten. He feels guilty and has persistent low mood. Most likely diagnosis is answer psychotic depression. So nihilistic delusions like rotten intestines, depressive symptoms like low mood, guilt, etc. indicate major depression with psychotic features, and normal grief lacks fixed delusions. So schizophrenia requires other psychotic symptoms. So normal grief, schizophrenia, all this can be excluded, and psychotic depression becomes the answer here. Next, what is the treatment of choice for postpartum blue? Again, a previous year topic, very important. So postpartum blue, we usually treat it with support and education. It's a self-limiting condition. And please learn about postpartum psychosis and postpartum depression as well, and their management. Next, a 25-year-old woman with nighttime leg crawling sensations relieved by movement. Which drug is used? Answer is gabapentin. So restless leg syndrome is treated with first-line drug as gabapentinoids because they have fewer side effects when compared to dopamine agonists like pramipexole. Next, a student has pre-exam episodes of impending doom and sweating. Diagnosis is panic disorder. Next one, maximum period. Also learn about the treatment of panic disorders and all, very important about that. Next, maximum period of voluntary self-admission under Mental Health Care Act 2017 is 30 days. Voluntary admission lasts 30 days unless extended. So requires psychiatric review for 90 days. Next, a middle-aged female patient presents with history of loss of interest in day-to-day activities, weight loss, insomnia, sadness for 6 months. She recalls hearing a voice once that ordered her to kill herself. What is DSM-5 diagnosis? Answer is major depressive disorder with psychotic features, and it meets the DSM-5 criteria for depression plus psychotic features because the patient has auditory hallucinations as mentioned here. And schizophrenia usually has a more bigger time span. It's like it should be more than 6 months of psychosis without mood episodes. Next question, an EEG image is given and it shows sawtooth waves, and which stage of sleep is that? It is REM sleep. And usually whenever they give the EEG image and when the sleep stage and other things related are asked, it's usually the REM which is commonly being asked, but other stages of sleep and other stages are very important. What are the important features of other stages are very important. So brief data is available here, and the waves associated with each of them are also being mentioned. Next question, 2021 PYQ. During psychotherapy, the therapist has mixed consciousness and unconscious feelings towards his patient. This is known as counter-transference. So when therapist has it towards the patient, it is known as counter-transference. And when the patient has it towards the therapist, it is known as transference. So both of these, don't get confused. Please learn about them. Next, a patient stopped alcohol consumption for 3 days and presented with irritability, disorientation, paranoid delusions, agitation, visual hallucination, and altered sensorium. What is the likely diagnosis? This is a previous year topic, very important. Delirium tremens. It is very important even from biochemistry point of view and all. It is very important thing, delirium tremens. It occurs 48 to 72 hours post alcohol cessation with autonomic hyperactivity like tachycardia and diaphoresis, hallucinations, and altered sensorium. So Wernicke's encephalopathy presents with ataxia, confusion, and nystagmus. And the next stage is the Korsakoff, which involves memory deficits and confabulation. Next, a teacher demonstrated hand washing steps and students later performed it. What type of learning is this? Answer is psychomotor. So, psychomotor learning involves physical skill acquisition through observance and practice. Next, which of the following is a formal thought disorder? Answer is derailment. Is a formal thought disorder characterized by disorganized thinking and loosened associations. This is seen in schizophrenia. And obsession and delusions, they are content disorders. And thought insertion, it is a possession disorder. So everything here, the disorders, all these the disorders of possession, disorders of content, all these please learn, very important. Thought disorders are very important topic, and every year 1 or 2 questions, like for every exam it comes very important. Next, a 16-year-old girl presents with over-familiarity, flight of ideas, elevated mood, increased sexual desire, and pseudo-hallucinations. Likely diagnosis is answer mania. It involves elevated mood, hyperactivity, and psychotic features like pseudo-hallucinations lasting for more than or equal to 1 week. Hypomania is a milder one. It is usually less than 7 days. It is 4 days and lacks psychosis in hypomania. And cyclothymia has chronic fluctuating mild symptoms. And schizomania is not a DSM-5 diagnosis. Now moving on to 2022 PYQs. A 16-year-old girl reports intense cravings for food, consumes large amounts rapidly, and induces vomiting afterward. Most likely diagnosis, answer is bulimia nervosa. So eating disorders, again, very important. Nowadays eating disorder related questions are coming up, very important. Even from INICET point of view, eating disorders is very important. Next, a woman 4 days postpartum presents with tearfulness, mood swings, and insomnia. Probable diagnosis, again a PYQ has come previously. The answer is postpartum blue, and the management is just reassurance. So please learn about postpartum blue, postpartum depression, postpartum psychosis, management features, all this important. Now 2023 PYQ, a schizophrenic patient was prescribed drug A after he did not respond to haloperidol and thioridazine. He now presents with excessive salivation, increased blood glucose, and hyperlipidemia. What is the drug A? Answer is clozapine. It is an atypical antipsychotic used for refractory schizophrenia, and the main side effect is excessive salivation, which causes wet pillow syndrome. Then hyperglycemia and hyperlipidemia are also seen. Next, a woman 4 days postpartum presents with tearfulness, mood swings, and occasional insomnia. What is the likely diagnosis? Answer is postpartum blue. Again, previously this question had come, repeat question, PYQ. Next one, a 25-year-old female reports anxiety, palpitations, sweating, breathlessness, and a feeling of impending doom. She has had 5 to 6 similar episodes in the past 6 months, each lasting 20 to 30 minutes. Diagnosis is answer panic disorder. This again is a PYQ. Again a PYT, very important. Panic disorder, very important. Next, a chronic alcoholic presents with confusion, ataxia, painful eye movement, and 6th cranial nerve involvement. Diagnosis is Wernicke's encephalopathy. This alcoholic patient with features and their delirium tremens, Wernicke's, Korsakoff, all these are related things. It's a PYT, actually very important. Please learn about these alcohol related conditions and the thiamine deficiency. It is even biochemistry related questions, so please learn. A middle-aged man with premature ejaculation is advised non-pharmacological management. What is recommended? Again a PYT. Answer is squeeze technique. Moving on to 2024 PYQs, a mother reported that her daughter ingested a substance in an unknown dose. The girl presented with hypertension, tachycardia, mydriasis, and hypothermia. What is the likely substance? So cocaine is the one here, because the features shown here are sympathomimetic features. So sympathomimetic drugs are the one which causes this kind of sympathetic features. And there's hypertension, tachycardia, and mydriasis seen in the patient. Also hypothermia. And heroin and morphine, they are opioids, and they cause bradycardia, hypotension, and meiosis, which leads to the pinpoint pupils. Next, a patient brought to the hospital after an RTA with symptoms of confusion, irritability, and tremors. He has history of consuming alcohol daily. Which drug is used to avoid withdrawal symptom? Answer is lorazepam. It is a benzodiazepine. It's a first-line drug for alcohol withdrawal to prevent seizures and delirium tremens by acting on the GABA receptors. Next, a young girl presented with multiple episodes of loss of consciousness lasting 20 minutes, occurring only in front of family members during daytime. No tongue bite or incontinence is seen, and EEG or MRI, both of them are normal. What is the management? Answer is insight-oriented psychotherapy. So this scenario describes a conversion disorder, that is functioning neurological symptom disorder, and there is episodes which are psychogenic with normal investigations and secondary gain seen in the patient. And psychotherapy, it addresses the underlying psychological stressors. Valproate, ketogenic diet, these are usually used for epilepsy, so all the other options are out, and insight oriented psychotherapy is the one here. Next, untreated ADHD persisting in childhood increases the risk of which of the following in adolescence? Answer is conduct disorder. So this question is a direct question. Please learn about this. If at all this question repeats, please don't make it wrong. Next, a 40-year-old female insists her face is deformed despite no evidence. She demands surgery despite reassurance. What is the management? Answer is SSRI. So the patient has body dysmorphic disorder and OCD spectrum disorder. So SSRIs are the first line pharmacotherapeutical therapeutic management here. Next question, a 24-year-old male, very calm and charming. He behaves well in front of psychiatrists but engages in fights, break rules, and has police cases. What is the likely diagnosis? Answer is antisocial personality disorder. So it is characterized by disregard for laws, rights of others, impulsivity, and lack of remorse. And the other conditions, personality disorders like narcissist, paranoid, schizotypal, all of them, please go through all these. Very, very important. Neet is now focusing on these kind of areas. Please learn. So if at all a question has come in 2024 from this area, there can be another question from any of the other personality disorders, so please go through that. Next, a patient on sertraline and amitriptyline develops serotonin toxicity. What is the treatment? Answer is cyproheptadine. So serotonin syndrome from SSRI and TCA is treated with cyproheptadine, which is a 5-HT2A antagonist. The other options like flumazenil reverses the benzodiazepines, and it's not used in the treatment of serotonin toxicity. L-carnitine and leucovorin, they treat specific overdoses like example valproate, methotrexate. Next, question number 8, an unconscious chronic alcoholic user with hypoglycemia of 45 mg per deciliter. NCCT is normal. What is the treatment? Answer is IM thiamine followed by dextrose. So chronic alcoholics, they're always mostly very, very related to the thiamine deficiency. So we have to provide them with thiamine as the management. Next, which selective norepinephrine reuptake inhibitor is used in ADHD? Answer is reboxetin. It is a selective NRI used off-label for ADHD. Next, a 30-year-old male dresses in a female lingerie to feel aroused with females. What is the diagnosis? Answer is transvestic fetishism. So all these other related disorders, please go through them. Very, very important. And there's something like gender dysphoria, homosexuality, testicular feminization. Please just have a small idea about them. These are not very, very important. They don't ask much about these 3 topics, but fetishism, transvestism, all these, exhibitionism, all these kind of disorders, please go through them. They're very, very important. Even the sections associated with them are also very, very important. Please go through them. Next, which drug is used in opioid maintenance? Answer is buprenorphine. It's a partial opioid agonist. It is used for maintenance therapy due to its ceiling effect. Next question, a 45-year-old female with chronic feeling tensed, stomach upset and diarrhea. Family members are nervous. Which symptom is likely? Answer is tingling of extremities. The patient has generalized anxiety disorder with somatic symptoms, that is tingling from hyperventilation. And ideas of reference, hallucinations and neologisms are seen in psychotic disorders, not anxiety. So that's it, guys. All of the 7 years psychiatric questions are being discussed in this video, and I hope it is helpful for you all. And if at all you are interested to buy my PDF, please do mention. You can contact me through my Telegram, or you can mention it in the comment box. I'll be guiding you. So that's it, guys, for this video. Till I come back with my new video, stay tuned. Till then, bye.